patient may not even remember having had a head injury. She may even sometimes have pain at the sign of the impact or a short period of time, or she may feel dazed for a few seconds, but then forget about it.
Hosted by Dr.Nguyen Quyen Tai, our program features expert neurosurgeon Dr.Nguyen Tai on how to spot symptoms stemming from a fall-induced head injury. Up next. Greetings, blessed friends, and our respectful welcome to Protecting Our Elders by Preventing Falls, Part 2 of 2. We once again have the honor to have our program presented by Dr. Nguyen Quyen Tai, who is a board-certified podiatric surgeon. Dr. Nguyen earned her Doctor of Podiatric Medicine degree from Barry University School of Podiatric Medicine in Miami Shores, Florida, USA. She has worked in private practice and at a VA Veterans Administration Hospital and Clinic for many years. Most recently, she was with the Foot Center of Northampton, Massachusetts, USA. At the Foot Center, she performed full foot surgery and provided therapeutic, restorative, and preventive podiatric care. She also diagnosed foot ailments such as tumors, ulcers, fractures, skin or nail diseases, and congenital or acquired deformities utilizing diagnostic aids such as urinalysis, blood tests, and X-ray, magnetic resonance imaging or MRI, and computed tomography CT scan analysis. In 2010, Dr. Nguyen joined the Supreme Master Jinghai International Association's Haiti Medical Disaster Relief Team to aid victims of the January 2010 earthquake in Haiti.
Hello, loving viewers. My name is Dr. Nguyen Quyen Tai from Ao Lạc, also known as Vietnam. We in Ao Lạc believe that your kindness to others is always treasured by the recipients of your supportive actions. Dr. Nguyen Quyen Tai, a practicing neurosurgeon in the U.S., has been a professor at the University of Florida College of Medicine, Jacksonville's Department of Neurosurgery for 30 years, and is the former chief of the department. In 2018, he wrote an article titled Mild but Dangerous Head Injuries that appears in a magazine published by the Vietnamese Association of Physicians, Dentists, and Pharmacists of Florida. In this article, he provides profound insights into why even a small impact to an aged person's head should be a cause for concern. The caring Dr. Tai is also deeply concerned with community health issues and leads the Life Weekly show, Questions and Answers program for health for Ao Lạc, also known as Vietnamese speakers in the U.S. who do not have access to a medical provider. The program is broadcast on Pao Talk, a video group chat room service. Dr. Tai and his colleagues involved with Questions and Answers program for health also provide valuable medical information to Ao Lạc speakers through a website, Facebook, and email. Additionally, Dr. Tai is keenly interested in improving public health in Ao Lạc and elsewhere in our world.
Besides our medical consultation service, our group also co-authored 2 booklets that we distributed online for the benefits of the Vietnamese communities worldwide. The first one is a pamphlet for the benefits of young women in childbearing age, giving them the basic recommendations as to how to keep themselves in good health, how to get appropriate checkups during their pregnancies, how to get prepared for their deliveries, and how to take care of their babies and raise them in the first few years of their lives. This booklet was printed and distributed by a humanitarian organization working in Vietnam to the people in small districts in the central region of Vietnam.
On today's show, Dr. Tai will talk about the reason an older adult may fall, what symptoms may result from such an event, and what actions to take after a fall to best protect a loved one.
There are many factors which may cause elderly people to fall, such as certain medications that they take, a number of medical problems, such as diabetes, high blood pressure, joint diseases such as arthritis of the knee or hips, spinal degeneration, neurological diseases such as Parkinson's disease, stroke, poor vision due to macular degeneration, cataract, just poor night vision in the elderly. All those above factors may make them fall or bang their head. These mild head injuries may not cause them great concern and are oftentimes forgotten. However, in this elderly population, a mild head injury can cause a minute bleeding at the surface of the brain, which can sometimes later form a large collection of liquid blood called chronic subdural hematoma. When this collection of old blood gets to be large enough to irritate or cause pressure on the brain, it may cause brain dysfunction, and if left untreated, it can cause a permanent deficit or even death.
We'll take a brief recess to relax and listen to the beautiful, uplifting sounds of the cosmos. Upon our return, we'll continue our conversation with Dr. Nguyen Quyen Tai. Please stay tuned to Supreme Master Television. Welcome back to our interview with Dr. Nguyen Quyen Tai, a neurosurgeon and the author of the article, Mild but Dangerous Head Injuries. Dr. Tai now provides an in-depth explanation of what symptoms a person with a subdural hematoma may experience.
A subdural hematoma may be completely asymptomatic in the beginning. The patient may not even remember having had a head injury. She may even sometimes have pain at the sign of the impact or a short period of time, or she may feel dazed for a few seconds, but then forget about it. But a few weeks later, or a couple months later, she may have a number of various symptoms, such as a headache, confusion, forgetfulness, speech difficulty, numbness, nausea, vomiting, crankiness, weakness of an arm or leg. All these symptoms are often neglected and ignored, and then they cause significant impairments, especially when the elderly patient does not have someone to share her concerns, or because she cannot readily access to a doctor for consultation. Because of all these symptoms caused by a subdural hematoma do not become manifest until many weeks or sometimes 2 or 3 months later, they are called chronic to indicate the fact that they have been present for a certain period of time. When a subdural hematoma is expected, it can be confirmed by a CT scan of the head. A CT scan of the head can be quickly done and does not cause any special preparations such as blood tests or injections. CT scan are less expensive, more available, and more rapidly performed than MRI scans. Chronic subdural hematomas require a surgical treatment by a neurosurgeon. The surgeon drills a hole in the skull. Once the hole is made, we can see the dura where the surgeon will make an incision to allow the subdural fluid to flow out. Usually, the surgeon will leave a small flexible plastic tube to allow the rest of the fluid to continue to drain into a bag for a day or two. A more sophisticated technique is to insert a hollow screw into a small drill hole and connect the screw to a drainage bag. The surgeon will remove the screw after a day or two.
For those who unfortunately have a subdural hematoma that is not treated, permanent damage may occur, leading to a decline in the ability to independently function over time. Dr. Tai now elaborates.
If the subdural hematoma is picked up before it has caused severe neurological impairment, early treatment may allow full recovery. However, if it is left untreated until the patient has suffered severe impairments, the recovery may not be complete, and the patient may suffer residual neurological deficit. My advice is to take all the necessary measures to reduce the risk factors in the elderly environment to prevent falls. People should be aware of mind-head injuries in the elderly people because they can cause dangerous complications days, weeks, or even months after the accident. Pay attention to subdural size and symptoms of developing subdural collection, and get the patient to a doctor who can order a CT scan of the head to identify the presence of a subdural hematoma. Once diagnosed, allow a surgeon to perform prompt evacuation. The operation is rather simple, the risk minimal, and the results very satisfactory if it is performed without delay.
Once again, we thank Dr. Nguyen Quyen Tai for joining us to share his advice on safeguarding the elderly from falls and spotting those with a possible subdural hematoma. His efforts to bolster community health in the U.S. and abroad are to be praised. May we all learn from his benevolent example of always thinking and caring for others and seeking to give back to society. It is individuals like him that help to create a happier and healthier world each day. For more information on the Questions and Answers program for health, chương trình vấn đáp sống khỏe, please visit facebook.com/ctvdsongkhoe15. Thank you, insightful viewers, for your company today on our program. Up next is It's Not Lonely to Be Alone, Part 1 of 6, on Between Master and Disciples. May all elders across the globe always have safe and convenient surroundings for a comfortable life. For more details, please visit suprememastertv.com/HL.